Hello, I'm Dr. Sarah Makhdoom, a family doctor in High River, Alberta, and I'm speaking on behalf of Canadian Global Care Society today. Um, our hot topic right now is the spread of coronavirus, and the infection is called COVID-19 infection. So we have been faced with this challenge, and we're not alone because this started in China and now it has spread all the way to North America and South America. I would like to tell you some symptoms that are associated with this infection. Most commonly, it's onset of fever, sore throat, cough, and then some people start getting worse after 5 to 7 days, and they develop some shortness of breath. So this shortness of breath could actually mean that they are developing pneumonia and lung fibrosis. So at that point, they definitely have to be seen by a physician or at a hospital. Prior to this, if they're just suffering from mild flu-like infection symptoms, they should stay at home and manage it conservatively. The most benefit that we've noticed is by preventing the spread of this disease, and that can be done easily by washing your hands, not shaking hands with other people, staying at a distance of at least 6 feet from other people, just in case they cough or sneeze on you, because that's how the aerosol is generated, which can cause the virus to land on your body and your clothes or your hands or your face. The virus can enter the body through open mucous membranes like the mouth, nose, and the eyes. So you have to continuously wash those areas throughout the day to prevent any virus from sticking to your body. Another thing is to keep a social isolation in case you have those infections. What's recommended right now is anywhere between 10 to 14 days. This is especially true for travelers returning to Canada or returning to any other country from another place. And this is important so that people don't carry that infection from one country to another and to their loved ones, which would be very dangerous. I would like to say that the curve in Canada, we are hoping that it will flatten out because of these strict measures that are being taken by the government. As you must have noticed that the Canadian government is now has now passed a law that all people entering Canada need to be self-isolating or keep themselves in a quarantine for 14 days. And if they don't do that, then they will be fined a very large amount of money or be jailed for that. So this is getting pretty serious. As citizens of this country, we have a responsibility to avoid infections to other people and keep everybody safe. So being clean and washing your hands and staying away from other people when you're sick is very important. At this time, some people are walking around. They have a mild degree of infection, but they don't have any symptoms right now. So there's no way of finding out if they have an infection or not, but they are passing it on to other people. That's why the provincial government and the public health officers and all your doctors are telling you to stay at home and wash your hands and avoid contact with places and people that can, transmit the infection to other people. We are, as doctors, we are at present undergoing training and planning on a very large scale to get ready for the onset of a pandemic situation in Calgary, because we expect the numbers to rapidly increase if people don't listen to our advice. And if that happens, most of the hospital beds will have to be taken by patients who are sick with respiratory symptoms and COVID-19 disease. and then all the ICUs will be taken up by patients who need to be on ventilators. And this will be a serious situation because even without this COVID-19 situation, our ICUs are almost 90-95%, sometimes 100% full already because of sick and very ill patients. So what are we going to do with those? It's a very dangerous thought, and when we as doctors have to start stratifying the sicker and the sickest patients and who to vent and who not to vent, I think that would be a very difficult situation. So the best part that you can play as the public is to stay at home, wash your hands, and maintain a 6 feet distance if you can. Avoiding any type of gatherings that are more than 15 people is what's recommended by the medical officer of health, as you must have all heard today. My advice is that just stick with the people in your own household only, and avoid anybody else. And if you can work from home, please do that. And if you have to be at work, then your work family is also your family. Try to maintain your hygiene even there, and try to maintain your 6 feet distance with them as well. And only don't put yourself at risk. So that's our message for today. So I'm cautioning Calgarians and all our Pakistani and non-Canadian travelers, because if they have a PR status, they are allowed to enter Canada. Otherwise, they will not be able to enter Canada at this time, because we have hunkered down to fight this disease, and we don't want any unnecessary burden on the system that we are already facing. So thank you very much. I hope that this message finds you in good health, and I hope to see you in a few months outside of this forum. So thank you on behalf of the Canadian Global Care Society. Thank you.